more than 83,000 people died in 2023 from opioids. Opioid use disorder changes the brain and makes it hard to quit. It affects about 2 million people in the US currently. What is medicated assisted treatment? MAT is medication plus counseling. The meds help with cravings and withdrawal, so those suffering from opioid addiction can focus on recovery. The counseling gives them tools and triggers to help them rebuild their lives. So why does the stigma around MAT exist? Here's the strange part. If you need medication for high blood pressure or diabetes, no one ever questions it. But with addiction, people still judge. Some people think that MAT is trading one drug for another drug. That is not true. These medications don't create a high when used properly. They stabilize the brain so people can parent, live, and work without constant craving. A lot of stigma comes from old stereotypes, lack of education, and how things are displayed in the media. The problem is the stigma creates a massive barrier. Only a third of people with opioid use disorder get treatment. The stigma keeps people from asking for help, and those who need the help often face barriers like distance or lack of transportation. A mobile MAT unit can break down those barriers and bring care directly to the community. They're staffed with trained medical and counseling professionals, and they follow very strict rules. Locked and alarmed safes for medication, no drugs left in the vehicle overnight, private area for consultations, and tight record keeping. This is why mobile MAT matters. A mobile unit can meet someone where they are and remove the biggest barriers to healthcare and starting them on treatment. Privacy is protected while providing the same level of care as a clinic. And people don't have to risk missing a dose because they couldn't get across town. Consistency is key, as those who are going through opioid recovery are at a high risk of overdose if they miss their treatment. So what does this look like in practice? When a patient first starts treatment, they have a private meeting to go over their current use, their history, and their goals. If buprenorphine is appropriate, they'll discuss timing and dosing. If methadone is the right fit and the program is an approved OTP, dosing and observation happen in the designated area. The team records each dose and schedules follow-ups. Therapy and recovery support are offered either on board or by referral, depending on the program. The key is privacy and dignity the whole time. Busting the stigma and bringing treatment to people through mobile care means that people can start recovery and stick with it. If we want to change the numbers, we can't expect people to come to us. We have to take the care to them. If you want to start a mobile clinic, check out a 3-part series on how to start one. If you have any questions, drop them in the comments. We're always here to help.